All right. Well, welcome everybody, and thank you for joining us for this live Q&A session for A Tale as Old as Time, using Mastermind principles to develop a method of networking for family leaders in Florida. I love the name of y'all's presentation, I have to say. I am Mara Leahy from AMCHP, and I'm going to be asking our presenters some of the questions that you all have submitted in the conference platform, but you'll also have the opportunity to come off mute and ask questions of them yourselves here. You can also put them in the chat. But we're going to go ahead and get started with just some introductions from our speakers. I know you've seen them in the recorded video, but you get to chat with them all live now. So Angela, I'll turn it over to you first.
Hi, everybody. Thanks for joining us, and thank you for taking the time to listen to the presentation. I am Angela Miney. I'm the coordinator of the Florida Family Leader Network, and really, this is Doris and Pam's presentation. I was just kind of coming along for the ride here, so I really appreciate all the work that they have done on this pilot, and I hope you have enjoyed hearing about it.
Doris, do you want to? Oh, there you
go. Thank you so much, Angela. Thank you, Maura, and it's a pleasure to be with you all. Thank you for taking this time. I just want to say this was a wonderful experience, and we are very excited about the future. So we'll be more than happy to answer your questions and add anything. I know there was a mention to another curriculum and I would love to know more about that. So definitely, please share. Feel free to share. And Pam.
Hey. I'm Pam Kissendall with the Florida Deafblind Program, and I have been super excited to work with Angela and Doris on this, and I'm happy to be here with you and looking forward for your questions. So keep them coming and we'll help you however we can.
Thank you all so much. So Pam, we'll go ahead and get started. We had a comment and question that came in that was directed towards you from Diane. I think Diane just joined, but Diane had asked mentioned that the Mastermind principles remind her of Circle of Trust touchstones developed by Parker J. Palmer and the Center for Courage and Renewal, and was just wondering whether you had heard of this resource.
I have heard of the resource. I have not been, just in passing or at a conference, but not in depth. So I'm not informed enough to speak on that. I'd love to learn more though.
Thanks, Pam. Another question we had gotten was around the manual and whether Joni asked whether the manual to become a facilitator is available to other states.
Okay, the manual currently is the one that is used in the family-to-family communities. We are in the process of developing a manual specifically for the FFLN community because our population in the family-to-family community, they're more parents driven. You know, they're parents who are growing into being facilitators. In the FFLN community, we're looking more at parents who are already leaders, so family leaders and champions. So it's a little bit different. So there are manuals available. However, for another state, it would be it can be available. We are willing to share and share our message and our connections. I do recommend, though, that it has to come with not just the manual. It has to come with some facilitation, guide processes, and some mentoring to be able to use it to its, to the maximum capacity. So you can have access to it, but just note that it will have to have some extra work with that. Hope that helps.
Could I just say that Pam and I actually this morning were working on amending the manual that she just talked about for the FFLN, and we're going to, actually Pam is going to facilitate a training for a small group, and that's kind of how we're hoping to develop more groups, as have an experienced facilitator work with a newly trained facilitator, having the manual kind of as your backup. But as Pam said, you know, her feeling is that what has worked is that you really need to do a training session along with it. And Pam is currently developing a 6-hour training session for us.
Other questions for our speakers? You can feel free to come off mute and ask those or put them in the chat. And if not, Angela had put a question in there because we want to make this interactive. So I'll see if anyone has another question at the moment. Otherwise, Angela, we can ask your question of the group. All right, I'm not seeing anyone coming off mute, but Angela had posed in the chat box whether you all could share what strategies that you're using for networking in your disciplines and with your colleagues. And you can just feel free to come off mute and turn your camera on if you so desire. I know it's late on day 3 of the conference.
I mean, if nobody wants to kind of chime in, I will just tell you that I'm really passionate about networking because I think that family leaders, I mean, Doris and I have talked, we've all talked about this a lot. Office that we work in or in, I mean, there aren't that many paid family leaders out there. And, you know, in my experience, certainly before we started the FFLN in Florida, I felt pretty isolated. In fact, both Doris and Pam, it turned out, worked kind of within the same buildings. We worked sort of within the same organization, but for different programs, and yet we didn't know one another. And here we were with children with special healthcare needs. We had things in common. We were, you know, working in this leadership role. And so, I mean, it has been really powerful for us all to get together. And, you know, since we started back in 2018, you know, we have over 100 family leaders now as part of our network just in Florida. And I know that I was a little bit envious of sort of other disciplines, you know, nursing and social work. You have your professional organizations and you have your networks, and yet family leaders, it's almost like, you know, it's almost like we don't need it or well, of course we need it. So we're now working it out, which is why I asked that's also why I'm curious too about networks that you find useful for yourselves. But I'd also love to know how, if you know how your family leaders network in whatever state you're in.
Yes, this is Marianne. I am from Puerto Rico. Hi, Doris. I love that you're from Puerto Rico. I love the Caribbean as well. In our case, I work for Title V in Puerto Rico, and we do have like 2 divisions. We're divided in maternal, child, and adolescent health, and then we have the children with special healthcare needs. And we do have a connection, and we do know each other, but we're kind of isolated as well. As a matter of fact, when we work on our Title V blood grant review report, at first, we were working it like we're different programs, even though we were receiving the same funds. So when we decided to, you know, to work it all together, we realized that the children with special healthcare needs had this fabulous network with families, with parents, and they had all that input, and they had these mothers that were coordinators, and they were supporting other parents in the pediatric centers, opposed to our programs that we do have a youth advisory council, but that's pretty much it. And we were trying like very hard. We have regional boards in all our regions, and we were trying to incorporate families as part of our boards, but it was difficult because they were working. When they got inside the regional boards meetings, they wouldn't understand our program. They were around professionals and they felt uncomfortable because they were not included in their conversations and it wouldn't work out. So when we started talking with the Children's Special Health Care Division, we realized that we needed to work together and use their experience and the Youth Advisory Council experience for us to have that kind of network. So right now we do not have, and I would love to have that, what you guys have, but we're working towards that. We need to first assess our staff. How is their readiness to receive that input? Because yes, we do have staff that we say, hey, our families are telling us about this, that, and that, this is wrong, we should do this. And they're like, oh, that's not true. They don't know anything about Title V, our services. Their input is not relevant right now. Just put it there on the parking lot, and someday we'll talk about that. And sometimes we felt very uncomfortable to go to our families, share them what our action plan is, and for them to see that what they've told us, their input is not there. So we're working on that with our staff, with our leadership, to educate them, because our long objective is to have a family network, not only for children with special healthcare needs, not only for youth, but we want it for all the domains inside Title V. We want mothers, we want fathers, we want aunts, grandmothers, we want all that kind of the core and family that would give us all that input that would help us to move on our plans, because sometimes we're stuck because they're not part of the decisions from the beginning. So thank you for sharing this experience. I am really excited, and I will share this with my colleagues as well. So thank you.
And Marianne, thank you for that. But you also, you should know that the Florida Family Leader Network is actually supported by our Title V Office of Children with Special Healthcare Needs here at the Department of Health in Florida. So if your colleagues need to talk to the professional arm of this, you need to get in touch with them. There. But thank you for sharing.
Thank you.
Thank you so much, Marianne. We really appreciate your feedback, and that's exactly what we have been noticing. And you bring in a point that is so important: is bringing those participants, and our goal is to reach the people who are members of our organizations, parents, and to have their voice represented. And I think for us, even throughout the pandemic, this was a very important tool. So thank you so much for sharing your experience, and we'll be more than happy to expand our conversation and share with you. And that's why we are here. Thank you.
This is Pam. I'm not sure if I'm muted or not because I'm on my phone now. My computer just died. But I just wanted to share that this format is used in every area. We mentioned it during our presentation, but what you mentioned, Miriam, about reaching the grandparents and fathers and a community at large, it just creates a really good structure to get the best out of the participants. So I'd highly recommend it. Lydia, you are unmuted. Did you have a question?
It's not really a question, but I'm just really excited to think about, I'm starting a youth advisory group, so thinking about using it with them. And then I also just took on the presidency of a family workforce association, and I'm thinking one of the things that they asked for, there were kind of 3 areas. One is networking, but not everybody wanted to do networking. So I'm thinking, okay, doing some of these groups will really help facilitate that. So I'm really excited to start using some of these techniques with some of the groups that I'm working with.
Mm-hmm. And that is excellent. I'm so glad you find it, exciting enough to want to incorporate it. I wanted to tell you that it's great for networking, but what it does as well within your networking and creating a community, it brings out a lovely discussion because there's so much support in the process to every participant who are in the group. So I think you're on a good path. If you try this, you'll get a lot of success out of it.
Yeah, I'm excited because we'll have a real diverse group of youth as far as intellectual abilities or neurodiverse abilities, or so some way to bridge those differences and to make them feel like a group.
Yes.
That's really exciting.
Heather has also asked about sharing the handbook, and I was just wondering, do you have any objections if I put your email address in the chat and people could reach out to you directly about the handbook?
No, please go ahead.
Okay. Because Heather, I don't know whether you heard a little when we sort of talked about the handbook earlier, that while Pam is willing to share, it's important to understand that there's sort of an element of training that goes along with it. And I'm sure for the right price, she might be willing to do the training, but the handbook itself probably is enhanced by the training.
I have to say, I learned with Pam. She trained me, and like she explained during the presentation. And we also use this model for the position I hold for early intervention is a family resource specialist. In other states, service coordinators provide parent support. In Florida, we have a dedicated personnel age local early intervention program helping families. But it happens that we were the only person in the office, sometimes two, no more than that. And that makes us to be very isolated. And we decided to come together, and with our now state parent consultant, she was working with ECPC, Early Childhood Personal Training Center, and we came with the idea of creating this same platform for our family resource specialists throughout the state. I know sometimes it sounds like very impersonal to be on Zoom, but we started in January, the pandemic hit in March, and we thought, oh, how things are going to go. It went really well. We have been 2 years already with this platform actively working. Every month we meet, we share ideas, we use the same model. And one thing I learned is that I have to stick to what I learned when I trained with Pam. Those guidelines at the beginning of the call are super important, because if not, things, they just go wild. and also the sense of ownership, because the topics belong to the members. They feel this is their call, it's their opportunity to share. And just to give you an idea, when we started, the lead position was vacant at the state level. And this was an initiative from us. It was not a state official initiative. And I started with Marisol, and she's now our state parent consultant. And we just had yesterday our first retreat in so many years, 4 or 5 years, something like that. The state is recognizing, it came the other way around. The state is recognizing the importance of having these groups and this networking. It's actually welcoming the networking. Instead of me having one presentation in my area, I'm using this platform to reach to families throughout the state and vice versa. So it's a great benefit. And my other benefit, I am in an area that I have 3 main urban areas, and the rest of my counties are mostly rural. And for families of young children, going to 45 minutes for an hour, a meetup is not feasible. And so that help us to bring families from different backgrounds to share and to contribute to our program, to make our program smarter, to provide, not only we provide for them a networking opportunity, but they provide feedback for us. So many different areas we meet. For the other program, we meet, like I mentioned before, once a month with families from the entire nation, or deafblind families. So there's so many opportunities. I love technology and I love this platform. So it's kind of, that's my lane side, but I think I see the value in reaching those who usually don't have that opportunity, and even for us as professionals to break those silos. That was our first, from the summit, from FFLN, was our first theme, and we have been true to that. Break the silos, let's get together.
I just want to quickly piggyback on what Doris said. I was invited to Doris's group yesterday for their retreat to do another presentation on a different topic. But what was really cool were the comments from her fellow peers from her group. It's like, oh my gosh, it's so great to see you in person. I've seen you in Zoom for so long, but they had already built a lovely relationship, even though it was distance, by getting that opportunity for that consistent engagement with the structure that allows everybody to fully participate. So that just warmed my heart so much. It was great to see that.
And through COVID, it kept us afloat. We were able to grieve together when it was time for that and celebrate together. So that's very important.
Yes.
I have a quick question. So would you, so we have what we call table talks on different topics every month. So it's not one group, it's whoever's interested in a particular topic, but do you think this format would be useful in like a one-time meeting, or is this really about that long-term relationship?
Both. It is absolutely.
Okay.
Actually, you said for our birthday parties as well.
Okay.
We get together, we celebrate a birthday, and we don't have the PowerPoint or everything, but the format, the structure, and the way we conduct our meetings. And they are fun and entertaining, but there's some, the way I feel it is everyone feels welcome, and everyone feels heard, and everyone participates. So there's not people on the margin. So that's the main thing for us.
Absolutely.
We were hoping to host a meeting like that for this presentation. Yeah. We had to do a recording in a different format, but we were hoping to do something like this with you.
I will tell you, as somebody who hasn't had any training and was really just a participant in this, I mean, I was sort of a little bit skeptical in the beginning, but they came to me with this idea and we really want to network. And I was sort of saying, okay, so we're going to have a meeting and there's not really going to be an agenda and we're just going to let people talk about anything that they want. And I'm going, oh gosh, this does not fit with my wanting to control things. And but they went with it, and I have to say that, I mean, I was a convert by the end. I mean, we did six sessions, we did a couple of follow-up sessions, and I can't wait to expand it out to our wider group. And as you saw on the video, you know, Doris gathered some data and presented that, and people really liked it and they want to continue it. But I mean, it's hard to sort of capture how good I felt at 1 o'clock on that Wednesday after sitting talking to people for an hour. But we all, I mean, even though you feel that there's no agenda, there is an agenda, because there is a structure and there's a way of making sure that, I mean, the facilitators make sure everybody gets to talk, everybody gets to share, and oftentimes, you know, there were topics that came up that were really burning issues for people on that day. And we were able to give the space to, I mean, they were important topics and we were all interested in them, and we were able to give the space to them. So it doesn't devolve, it doesn't, you know, it doesn't just become a chit chat and a sort of talking about within the news today or whatever. There really is structure to it. And I know that Pam and Doris put a lot of work into it all. You see, I'm definitely a convert now.
And we love it. We love it. And Angela, Doris, Angela, and I are actually at our state disability conference in Florida right now. So we're all in our individual hotel rooms in this giant hotel. And we, of course, wanted to be here with you guys. But, you know, Angela also did a presentation yesterday, and the format that is used in this mastermind methodology can also be used as in a live setting. So Angela, I saw her pull in some of the things that she's learned in this process in her live presentation yesterday, and I was again, heartwarming to see the how it spreads. It's like a ripple effect, and it's great because it's something that you learn and you are able to apply in many areas of your life, and it makes your work and your feelings about it as you deliver it much more enjoyable as well.
And definitely meetings more productive. Because I am not a big fan of sitting at a meeting that when I finished, there was nothing done. We just met because we had to meet. I don't like that. I value my time. So these meetings help to keep a structure so we can accomplish things, and we can, especially the areas that we have to reach consensus and everyone has to be heard. So you avoid having those after the meeting talks that really damage whatever project we are working on, because everyone feels this is a safe place where I can express myself. So it works for many different platforms, and I'm all for organized meetings. That's I know Maura and Kate appreciate that.
You all are speaking my language. Well, this has been fabulous. Unfortunately, our time is about up, but I was wondering, I know Pam's email got pasted in the chat. Angela and Doris, would you both be willing to share your email addresses in the chat in case any of our participants had any follow-up questions for you all?
Anytime, can email me. I'll be more than happy to support in any way we can and share more of this information with you.
I am also putting in the link to the Florida Family Leader Network, which is floridaleaders.org, and feel free to check out our website.
Well, thank you to this fabulous session, our terrific presenters, and to everyone who has logged on for your participation today. So I hope you all enjoy the rest of the AMCHP conference, and hopefully be seeing you all soon.
Thank you, everyone.
Bye.
Thanks, everyone.
Thank you.